Today topic of discussion is a viral hemorrhagic fever. It is a group of viruses causing hemorrhagic condition. Viral hemorrhagic fever include the group of illness which are caused by different family of virus. So group of illness caused by different family of viruses, and a common manifestation is that there is a vascular damage which result in the symptomatic bleeding. So vascular damage result symptomatic bleeding. So group of illness which are caused by different family of virus, and a common manifestation is that vascular damage which result in the symptomatic bleeding. There are three main groups of virus which causes viral hemorrhagic fever, that are Arbovirus, Flavoviruses, and rodent-borne viruses. Three groups of viruses causing viral hemorrhagic fever: Arbovirus, Flavovirus, rodent virus. Now, these virus which are causing viral hemorrhagic fever, they are enveloped RNA virus. All these viruses are enveloped RNA virus, and in some cases they can be mild, and some cases they become severe. Now, how the patient will present that is viral manifestation: fever, fatigue, weakness, dizziness, and muscle ache. Patient feel fever, fatigue, weakness, dizziness, and muscle ache. If that disease is presented in severe means, it will causes bleeding under the skin, internal organ. It will causes diarrhea, shock, delirium, and kidney failure. In the case of severe, bleeding under the skin, internal organ, diarrhea, shock, delirium, and kidney failure. Now, the first virus group is Arbovirus. These Arbovirus are those viruses which are transmitted by means of the arthropoda vector. How it will transmitted? Arthropoda vector. So they are mainly transmitted by arthropoda vector. Now there are mainly 5 families are there. That is the family 1 name is called as Tocaviridae, which include the genus Alphavirus, including Eastern European encephalitis virus, Western European encephalitis virus, Venezuelan European encephalitis, and chikungunya. So family first one is Tocaviridae. It including Eastern European encephalitis, Western European encephalitis, Venezuelan European encephalitis, and chikungunya. Second family, Punniaviridae. Genus Punniavirus, example California encephalitis, Nairobi virus, then Fleefovirus. Punniavirus example Nairobi virus and Fleefovirus. Example California encephalitis. Next family Flaviviridae, genus Flavivirus, which include all the important virus, and every virus is important in this category, that is yellow fever, dengue, Japanese encephalitis. So third one is Flaviviridae. This one including yellow fever, dengue, Japanese encephalitis. Fourth family Rioviridae. That include the genus of Arbovirus, example African horse sickness. Then family Rhabdoviridae. Genus Vesiculovirus. Example Santipura virus. So Tocaviridae, Punyaviridae, Flaviviridae, Rioviridae and Rhabdoviridae. Different type of families. So the alpha virus, that is the chikungunya, that is the vector which is transmitted this virus is Aedes, and this include host or humans and monkey or both. This is mainly the fever, arthalgia and arthritis. Alpha virus chikungunya, that vector Aedes mosquito, host human and monkey or both. What are the symptoms it will causes? Fever, arthalgia and arthritis. Then dengue, that also transmitted by Aedes mosquito. The symptoms mainly mild symptoms, and breakborn fever, dengue hemorrhagic fever, then dengue shock fever. So second vector, that Aedes mosquito only, it causing disease, the dengue, symptoms mild symptoms, and breakborn fever, dengue hemorrhagic fever, dengue shock fever. Next one is yellow fever. Again that vector is Aedes mosquito only. This one distributed Africa and South America, and it include the involvement of liver and hemorrhagic fever. Third one is yellow fever vector, same Aedes mosquito, distributed in Africa and South America. It mainly causes infection in liver and hemorrhagic fever. Then Japanese encephalitis, here that vector is Culex mosquitoes, mainly distributed Asia only. And what is the disease it will causes? Means it will causes encephalitis. So Japanese encephalitis, vector Culex mosquito, distributed Asia. Then transmission. Mode of transmission for the arbovirus, mainly it is formed from man to arthropod to man. So mainly dengue, urban yellow fever, reservoir may be either man or arthropod vector. So this is the man arthropod cycle. Another is animal arthropod man cycle. So how this can be taken up by this vector and being transmitted to man? That animal reservoir, in many cases the actual reservoir is not known. That is mainly like different if animals are involved, that like birds they can access reservoir in case of Japanese encephalitis. Pigs also, birds and pigs also involved. In Japanese encephalitis, monkey for yellow fever, rodent for this encephalitis viruses. Birds, big Japanese encephalitis, monkey for yellow fever, rodent for this encephalitic virus. Now, what are the different arthropod vector play a important role? First one is mosquito. That play almost all important disease. Mosquito only mainly transmitted important diseases, most of the diseases. Japanese encephalitis, dengue, yellow fever, most of them is Aedes virus. Mosquitoes only causes. So what are the diseases mosquito will cause? Japanese encephalitis, dengue, yellow fever. Then ticks play a important role in Crimean, hemorrhagic fever, various tick-borne encephalitis, etc. And sandflies. For sandfly fever, Rift Valley fever. Third one is sandfly. It causes sandfly fever and Rift Valley fever. So mosquito, Japanese encephalitis, dengue, yellow fever, Tricks, Conco hemorrhagic fever, tick-borne encephalitis, sandfly fever, and Rift Valley fever. Then properties. What are the properties for this arthropoda virus? So all the viruses are RNA virus. These are liable virus. So there are being readily inactivated at room temperature and by bile salt, ether and other liquid lipid solvent. Inactivated room temperature and bile salt, ether and other lipid solvent. Next, antigenic structure. Three antigen are important in serological studies. Heme occludin, complement fixing and neutralizing antigen. These three are important in serological studies. Heme occludin, complement fixing and neutralizing antigen. Then pathogenesis, how this virus enter the body through bite of that insect vector. Through insect vector bite only this virus will enter. It multiply and enter to the blood. This condition name is called as primary viremia. From there it multiply, then it enter to this reach to this reticuloendothelial system. Again it will enter to the blood. So this condition name is called as secondary viremia. In some cases, the virus transported to the target organs. What are the organs? Central nervous system. In encephalitis, yellow fever for liver, capillary endothelium in hemorrhagic fever. So these arbovirus, they infect both vertebrates and invertebrates and human. The dead end host, once the virus reach to the human being from these, that will be last host. Once it reaches to the human, means human is the last host. Type of cycle. One is jungle cycle, another one is urban cycle. This from monkey, the arthropoda will take the virus transmitted to human. This jungle cycle virus from monkey, this arthropoda will take that virus and transmit it to human. In urban cycle, it is between the human only, and arthropoda are transmitted between that human. So these are the two type of cycles. Laboratory diagnosis, specimen, blood, CSF and brain. Vaccine preparations, that is inoculated into egg inoculation, cell line and animal inoculation. Mainly shucking mice we can use for these studies. So vaccine preparations, three method of isolation of that virus by using egg inoculation, cell line and animal inoculation. Then isolated virus identified by heme occludin assay method, gel precipitation method and a complement fixing test. What are the method we can use for identification purpose? Heme occludination as a complement fixing test, gel precipitation and immunofluorescence and neutralization test. Then how to control this infection by using vaccination, yellow fever vaccine, Japanese encephalitis vaccine, Russian tick-borne encephalitis vaccine. These are the vaccines available. Thanks for watching.